Welcome everybody to my channel. This is Dr. Julius Kwedi coming to you from Moscow, Russia. Today I'm presenting a curious case of necrotizing fasciitis. Patient presented on Friday evening during night shift. He has a history of an operation on the left thigh. They did a transplant, bone transplant, and they put a prosthesis there, and he was complaining of right knee pain and swelling, as well as swelling of the right leg. Upon inspection and asking questions, he could not tell me exactly when he began to feel pain, but he was concerned about the pain and the edema of the thigh, of the leg. We're going to ask a lot of questions, and upon palpation of the right leg, I could feel the subcutaneous emphysema, subcutaneous crepitation. I immediately asked the body temperature of the patient, which was 37.6. And I notified them immediately that this is an infection. The signs and symptoms that the patient presented with were more consistent with a subcutaneous infection rather than an acute or chronic limb ischemia. The patient was intoxicated and could not answer the questions well. The patient was intoxicated and was not answering to the questions very well. So putting everything together, intoxication syndrome, right leg crepitation, subcutaneous emphysema, and yes, those two signs for me indicated that this patient has subcutaneous necrotizing fasciitis. You can see the subcutaneous emphysema here around in the pelvis, on the thigh, subcutaneous on the thigh, here in the abdomen, as well as the thoracic cavity, not thoracic cavity, but thoracic region. Subcutaneous emphysema again. You see these are the lungs. That's the heart there. This is our aorta here. And as we move down into the thoracic cavity, right here, subcutaneous, you can see that there is air here under the skin here, as well as here. There you go. You can see the subcutaneous emphysema. You can see the emphysema here in the pelvis, right there, very well marked here, involving even the gallbladder here, the wall of the gallbladder, as well as the kidney, the right kidney. And you can see here the right thigh is well markedly involved here, and the right scrotum here is totally eaten away. The right testicle is totally eaten away. You can see it continues all the way down into the lower pelvis. And you can also see that that there is also emphysema on the left leg. You can see here, there's also emphysema there. So we are suspecting that this emphysema is from the colon. We're suspecting that it's from the colon, as you can see here. Right, as you can see these communications here. But I'm also suspecting that this infection is from the bone transplant. It's from this implant that has been put in. It's from this implant here. It's also possible that the infection is from this implant that has gone through into the blood or through the subcutaneous spaces into the contralateral side, but it's most likely that it's from the colon. This CT scan was done in another hospital. We sent the patient to the Gnoina Gnoina chirurgia, that is surgery of the suppurative surgery, so to say. They're the ones who treat these conditions. All right, you can see here, that's air right there within the muscles, air within the muscles. You can see air right on the pelvic bone here, around the pelvic bone. You can see the involvement of the right kidney right there. The upper pole of the right kidney is involved right here. The thoracic area here, lower thoracic area, you can see the skin is involved there. Right there in the abdomen. Right, this is the hip region, and then the thigh is involved, markedly involved. Right there around the head of femur, around the femur there, the promontorium. All right, it's quite marked, very, very marked there. The femoris muscles are totally eaten away here. You can look at that, totally eaten away. Just fluid and gases here in the scrotum. All right. So this is one case that you would want to not miss if there's such a patient comes to your ED. You need to quickly identify the subcutaneous emphysema and send the patient to the right department. All right. Let me just let this CT scan run, and then you can check it out.
Здесь нет перчаток. А что это? Ты? Извиняюсь. Можно налить? Да, конечно. Спасибо. Благодарю. Готовы. Не понял. Я не могу.
Хорошо. Хорошо. Да эту курточку, если можно, сверните, тогда курточку.
Лекарство.
Да, туда пакет какой-нибудь.